Hello, I'm Dr. Richard Amy. A lot of people know me as the Laser Doc. We're going to talk about the true laser combination of laser and electrical stem for treating skin conditions. This works so well because we're getting the laser shooting photons into the skin, creating extra collagen. It helps break down scars, it breaks down scar tissue, it helps with stretch marks, and we're going to be talking about wrinkles and bags under the eyes. So I can tell I'm aging. It's by my eyes, right? The eyes are usually the giveaway. So I love this laser for a combination of reasons that I can put it and I can cover a nice surface area, right? I have a nice area. You see a lot of the lasers coming out with a lot of the estheticians and that. They're usually round lasers and they're not very big, right? They don't really cover a whole lot of surface area. And a lot of them aren't true lasers, right? They're a combination of lasers and red light or LED. I can tell you that a laser works 10 to 20 times better than an LED. So we love the red light therapy. We're not against the red light therapy, but I'm telling you, it's nothing like a true laser. And so we have 12 true lasers in here, right? So those lasers in both red and infrared. So we're going to use that combination and we're going to cause a little bit of electrical stimulation to tonify. So when you look at the skin is just over muscles. As we age, right, what happens to our muscles? We lose tone. As we get older, what happens to our head? We start to come forward. So if my tone of my muscles for my SCMs and scalenes in my neck, right, are supposed to be back over my shoulders and that, and if I come forward, my muscles shrink, but what happens to the excess skin? So here I started out with a nice layer over my muscles, right? My muscles shrink, but what happened to that skin? Now it becomes flabby, to be honest with you, and we see a big skin, especially in our necks. So lots of times this is a consequence of just our posture, and that happens as a consequence. Many people are looking at thyroid problems, which I'm really not to go into. But I really want to increase tone in the skin, which means I need to do what? I need to stimulate the muscles, and the laser is phenomenal for that. And then I want to do exercises. So this is one of the keys. The laser works better while you do motion or exercises. So for me right now, I'm using a topical, right? So I use a topical here. I put those underneath my eyes and I let it sit in there for just a little bit. And then I take the laser and I turn it on, right? So we're going to turn it on. I heard it, a little beep there, and I want to do, let's say 10 minutes. I have it on 10 minutes. I want to do laser 1. This is where I get the frequencies, those precision ones that are made for the skin to even enhance it even more. And then I put it underneath my eye, right? So I have the topical on. That's dry for me. You don't want to get a lot of oils, especially on this, but you can definitely use lotions. I use MS Slim lotion. I use other type of lotions for it. And then I want to come underneath these eye bags, right? This. If you're not comfortable, use the glasses. I'm telling you, this isn't going to do you any harm. But if you're apprehensive at all, I encourage you to use the glasses. Then I turn it on. So the laser's on, right? You can see the laser's on. I put that on my eye and I let that go. Now, the bottom one is for electrical stem. It's much easier, or you don't get quite as bite sometimes with the electrical stem if you put it on the skin first, right, and then hit the button. Ooh, I can feel that toning underneath. It's buzzing underneath there, which is really cool. If I take it off, right, it goes away. But if I put it on, you're going to get a little bit more jolt when I put it on with it already going, as opposed to turning it on the skin. One more time. On the skin, then I turn on the E-stem, I don't get quite as much of a bite. If I take it away and I put this on, it's like, I can feel it there. I'm a little apprehensive, and then it calms down, and then I get a nice potentiation of laser, increasing the collagen, increasing the tone of the muscles. So this is really cool. I just hold it there. I can be watching TV. I can be doing whatever I want. I like to do 10 minutes on the right and 10 minutes on the left. This is a good procedure. Lasers in skin conditions, you need to understand that your skin An old cell is being replaced by a new cell every 28 to 35 days, so 4 to 5 weeks, right? So let's say my skin cell here is only like a 2 on a scale of 10, 10 being maximum. In 4 to 5 weeks, I can take that 2 to maybe a 4. It doesn't go directly to a 10. So you're going to see the best results after a couple replication of healthier cells. So about 90 days, you really see some long-term condition. Then I have to come back and just do a little bit of maintenance. But I really encourage you to really be working at this for about 90 days, maybe 2 to 3 times a week. But if you're really a go-getter and you want to do it every day or whatever you think about it, that's awesome too. So the laser is going to work no matter what you do. That laser light increases collagen, combined with the E-stem increases tone, right? So we're trying to, in a facelift, we're trying to bring you up, right? So we're going to look at different things when doing a facelift. So if I want to use this for a facelift, I'm going to do muscles that are higher, and I'm going to do different types of exercises and combine with it.